Welcome to Healing Insights, the podcast where we explore the intersections of health, wellness, and holistic living. I'm your host, Dr. Tara Coppola, and today we are diving into a very powerful theme: gratitude as medicine. As we discuss the profound impacts of gratitude on our health, please remember the information shared in this podcast is for educational purposes only and should not replace professional medical advice. Always consult with your healthcare provider for any medical issues or concerns. So, before we dive deeper into all of the topics we're going to discuss, we want to explore what gratitude actually is. At its core, gratitude is a recognition and appreciation of all positive aspects in our lives. It's an emotion that invites us to acknowledge the good things we often take for granted, whether they come from people, experiences, or even nature. Gratitude can be as simple as appreciating a warm cup of coffee in the morning, or as profound as recognizing the support of a loved one during tough times. Psychologists define gratitude as a complex emotion that encompasses not just feelings of thankfulness, but also a sense of appreciation, which can lead to a range of positive outcomes in our lives. There are a few key elements to gratitude. First, we have acknowledgement and appreciation. Gratitude involves both acknowledging the good things in our lives and appreciating their value. So, it's not just about saying thank you. It's about truly feeling thankful in that moment. Another element is positive recognition. It often involves recognizing something outside of ourselves, which can shift our focus away from negativity and towards positivity. It can be seen as a response to kindness or a reflection of the natural beauty around us. Another element is cultivating connection. Gratitude fosters deeper connections with us and others. When we express our thankfulness, we strengthen our bonds, whether with family, friends, colleagues, or even strangers. And the last element I'm going to discuss is gratitude is a transformative process. While gratitude is a natural emotion that can arise spontaneously, it can also be intentionally cultivated through practices like journaling, meditation, or simply reflecting on daily experiences. Research indicates that practicing gratitude not only boosts our emotional health, but can also impact our bodies. People who regularly engage in gratitude practices report fewer health complaints, better sleep, and enhanced immune function. In essence, gratitude isn't just a feeling. It is a powerful mindset that can significantly enhance our quality of life and promote overall well-being. As we continue, we're going to explore how to harness this powerful emotion as a form of medicine for our minds and bodies. But first, I want to dive into some of the research behind gratitude. So, we're going to touch on three main areas of research in regards to gratitude. The first section we're going to talk about is going to be the use of gratitude in our prison systems and how that has led to more positive outcomes. Then the next thing we're going to talk about is gratitude practices, specifically with the use of PTSD and how that is affecting health. And then the last set of research that I'm going to pull in for you is gratitude practices in oncology care. And then we'll talk about how you can pull in different gratitude practices for your own well-being. Okay, Got a lot of research to get through, so just listen now, and I'm going to input all of the research citations on my website in the blog for this podcast. So, here we go. Some studies suggest that incorporate gratitude practices into rehabilitation programs can help to actually reduce recidivism rates. So what that means is utilizing gratitude can help to reduce the rates that those who are incarcerated go back out and end up getting incarcerated again. For instance, there are programs that focus on personal reflection, positive thinking, and gratitude, which can foster a sense of hope and personal responsibility, which are crucial for successful reintegration into society. There are going to be a couple studies that focused on this that I will cite in the blog. The first one is the effect of gratitude on recidivism rates among inmates. The next one is gratitude and rehabilitation. It's a pilot study that was done. Next, what is found is research is showing that practicing gratitude can actually enhance emotional regulation, which is particularly important in the prison settings where individuals may experience high levels of stress, anger, or frustration. This is why I wanted to bring you research on this specific topic, because those who are incarcerated in the prison systems live in an environment of constant stress, constant potential fight or flight stimulation all the time, anxiety, anger, fear. When we're immersed in these very strong negative emotions constantly, whether it be through trauma cycles or situational experiences at that moment, it is very, very hard to focus in and feel gratitude. However, when we can find the space and time to do so, it can benefit us greatly. What these next studies have found is that by building emotional resilience through gratitude exercises, the inmates may be better equipped to manage their emotions and avoid conflicts. So the two studies of importance here are the impacts of gratitude on emotional regulation in incarcerated individuals and gratitude and emotional regulation in the prison population. Next, just as in the general population, gratitude practices in correctional facilities have been linked to improved mental health outcomes. Gratitude interventions have been associated with reductions in symptoms of depression and anxiety, which are prevalent in the incarcerated populations. Improved mental health can lead to better coping strategies and overall well-being. The studies of interest, if you want to look more, are the effects of gratitude on mental health in incarcerated individuals and gratitude and mental health in a prison population. Then gratitude is noted as promoting positive relationships among the inmates, between the inmates, and between the inmates and staff. Programs that encourage expressions of gratitude and appreciation can help to create a more supportive and cooperative environment, fostering a sense of community and reducing hostility. The studies here specifically are the role of gratitude in building relationships among inmates and gratitude and social connections in a prison population. Then we come to gratitude's effect on attitudes and behavior. Research has indicated that gratitude can positively influence attitudes and behavior in inmates. In inmates who engaged in gratitude exercises, often reported improved attitudes towards their rehabilitation and had a greater sense of purpose, which can lead to more constructive behavior while incarcerated. The studies of importance here are the impact of gratitude on attitudes and behaviors among inmates and gratitude and behavior change in the prison population. And lastly, we have gratitude in actual therapeutic programs. Some therapeutic interventions within the prisons have integrated gratitude as a component of CBT, which is cognitive behavioral therapy, or mindfulness practices. These approaches help inmates reframe their experiences, focus on positive aspects of their lives, and cultivate hope for the future. The studies of importance are cognitive behavioral therapy with gratitude and mindfulness stress reduction with gratitude. So, while the body of research specifically focusing on gratitude in the prison systems is still growing, the existing studies highlight the potential benefits of gratitude practices in promoting healing, personal growth, and rehabilitation among incarcerated individuals. Now, let's explore a compelling topic that intersects mental health with emotional well-being. It's the connection between gratitude and post-traumatic stress disorder, or PTSD. PTSD can arise after experiencing or witnessing traumatic events and is characterized by symptoms such as intrusive thoughts, hyperarousal, and emotional distress. Now, PTSD can occur because of one major traumatic stress or many small traumas throughout life, also known as complex PTSD. Both can have the same exact symptom presentation: intrusive thoughts, hyperarousal, emotional distress, flashbacks. So it's really, really important to pull in gratitude and see how it can drastically affect someone. The impact of these symptoms on people can be profound. They can affect one's quality of life, relationships, and mental health. Research has shown that cultivating gratitude can play a significant role in managing and alleviating PTSD symptoms. We're going to discuss some key findings from the various studies. So, the first one is reduction of symptoms of PTSD. In a 2014 study published in the Journal of Traumatic Stress, researchers found that individuals who engaged in gratitude practices often reported lower levels of intrusive thoughts and hyperarousal. By shifting their focus towards what they were thankful for, participants experienced a decline in distressing reminders of their trauma. The two studies that are of interest here is there's another effects of mindfulness on psychological health, so a review of empirical studies, and gratitude and well-being, a review of theoretical integration. Then we have enhancing resilience. Gratitude fosters resilience, which is crucial for those dealing with PTSD. Research published in Psychological Trauma, Theory Researched, Private Practice and Policy in 2017 found that gratitude helped individuals develop positive coping strategies. Those who expressed gratitude were better able to bounce back from traumatic stressors. Another good research article about this is the relationship between gratitude and resilience in graduate students, a model study. Then there's improving emotional regulation. Another benefit of gratitude is its potential to enhance emotional regulation. In 2019, a study featured in the International Journey of Environmental Research and Public Health, gratitude interventions helped participants manage their emotions more effectively. This is particularly important for individuals with PTSD, whose emotional response can often be heightened or dysregulated. Another study of interest from 2018 is gratitude and emotional regulations associated with psychological well-being. Then, gratitude is linked to promoting positive affect. It can increase positive feelings, which can counteract negative emotions commonly associated in PTSD. A meta-analysis in Clinical Psychology Review from 2017 found that gratitude practices not only led to higher levels of happiness, but also reduced depression and anxiety symptoms among various populations, including those affected by trauma. Another 2010 study was the absence of positive psychological variables, gratitude in the deprivation context. Then we have gratitude journaling, and we're going to talk about this a little bit more later. This is a specific practice that has gotten a lot of attention. It is journaling on things that we are grateful for, basically. We'll talk about it a little bit later. A study published in the Journal of Positive Psychology in 2016 noted that participants who maintained a gratitude journal experienced significant reductions in PTSD symptoms over time. The simple act of writing down what participants were thankful for created a shift in their focus away from their trauma. Some other important research articles with regards to this are Benefits of Gratitude and Emotional Perspective, and The Impact of Gratitude Interventions on Mental Health, a longitudinal study. Many trauma recovery programs have begun integrating gratitude into their therapeutic approaches. For example, some cognitive behavioral therapy techniques now include gratitude exercises. They can help individuals reframe their experience and cultivate a more positive outlook, which can be incredibly beneficial during recovery. A study of interest is the effects of mindfulness on psychological health. And then we come to our veterans and our first responders. It is important to note that gratitude practices have shown positive effects in significant populations at high risk for PTSD, such as our veterans and our first responders. Programs that incorporate gratitude have been associated with improvements in their symptoms and overall well-being. A 2014 study, The Contribution of Gratitude to the Psychological Well-being of Military Veterans, discussed how gratitude impacts the mental health of veterans, particularly in relationships to PTSD. The research suggests that gratitude serves not only a tool for emotional healing, but also a powerful mechanism for managing PTSD symptoms. By integrating gratitude practices into our daily routines and therapeutic interventions, we can create pathways for recovery and resilience in the face of trauma. As we delve deeper into the healing aspects of gratitude through this episode, I encourage you to reflect on how fostering gratitude might serve you or someone you know managing the challenges of PTSD. If you are experiencing PTSD, reach out for support. You do not have to go through this alone. There are many, many tools available to help. Trauma has a major, major impact on the brain and its functioning, along with impacting every other facet of our health. Getting the support that we need is critical when we are trying to heal ourselves from our traumas. As we continue the exploration of gratitude, I want to dive into its profound effects on healing, both emotionally and physically. Research has increasingly shown that cultivating gratitude can be a powerful tool in recovery and overall well-being. The Journal of Social Psychology found that individuals who kept a gratitude journal reported higher levels of positive emotion, life satisfaction, and even better physical health compared to those who focused on daily hassles. Participants in the gratitude group not only experienced fewer symptoms of depression, but also reported more optimism in their lives. This emotional uplift led to a healthier mindset, which is critical for any healing journey. Remember, as we've discussed before, in vitalism, every aspect of our being is connected. Our physical, mental, emotional, and spiritual aspects. So bringing ourselves into more of a positive mindset, positive thinking realm, we can help to flip the script, and bring more healing to the other aspects of ourselves. Gratitude does not just improve emotional health. It has a tangible physical health benefits as well. Research conducted by the University of California, Davis, found that people who regularly express gratitude report fewer health complaints, better sleep quality, and even a greater willingness to engage in healthy behaviors. In one study, participants who practiced gratitude showed improved immune function, which is essential for healing and recovery. When we adopt an attitude of gratitude, we often take better care of ourselves, leading to a more holistic approach to health. Gratitude has been linked to decreased levels of stress. which is incredibly important in the healing process. A study published in Psychological Science found that individuals who practiced gratitude had lower levels of cortisol, the stress hormone, and engaged in behaviors that promoted relaxation and resilience. When we experience less stress, our bodies are better equipped to heal, whether it's recovering from illness, dealing with trauma, or healing from emotional pain. Another significant aspect of gratitude is the ability to strengthen relationships. Research has shown that expressing gratitude fosters positive integration and deeper connection with others. A study published in Emotion in 2009 found that couples who practiced gratitude reported higher levels of relationship satisfaction. The act of expressing appreciation can lead to increased feelings of closeness and support, which are vital for emotional healing. And gratitude encourages a positive mindset that cultivates resilience. In the context of trauma recovery, gratitude practices can help individuals reframe traumatic experiences, focusing on what they've learned or gained rather than solely on the negative aspects. This shift in perspective is fundamental in many therapeutic practices and is supported by findings from research reported in Clinical Psychology Review, which affirms that gratitude contributes to an increase in well-being and healthier outlook on life. As we continue our exploration of gratitude, let's turn our attention to a compelling and hopeful area: the potential impact of overall survival for cancer patients. While research is still evolving, several studies suggest that gratitude and positive psychological states may have beneficial effects on health outcomes for those battling cancer. Now, cancer touches almost all of us in some way, shape, or form, either ourselves or our loved ones. And when we're diving into the research for cancer, there's various things to look at. Looking at overall survival is looking at the overall outcome and life length of patients who have cancer. So when diving into the research for us today, I specifically focused on overall survival. Now, a lot of research article writers don't input the data on overall survival, so it makes it a little bit challenging. But we're going to do our best to dive in, and I'm going to give you as much information as I possibly can. So, first, let's consider the link between positive psychological states and health. A meta-analysis published in Health Psychology examined how emotional well-being, including gratitude, relates to health outcomes. The findings indicated that positive emotions can boost immune function and reduce stress, which are both crucial for patients managing cancer. So, why is boosting immune function and reducing stress critical? Because our body only has so many resources. And when our body is battling cancer, we need as many resources as possible to be able to fight the cancer. So, reducing stress reduces the body's fight or flight and allows the body to take that energy that would have been focused in stress and fight or flight and put it towards fighting the cancer. And then if we have a better immune function, our body can combat more efficiently what is happening in the system. The research of focus here is Positive Affect and Health from 2001. It was a meta-analysis that discussed how positive emotional states correlate with health outcomes, enhance immune functions, and reduce stress. In a 2014 study from Psycho-Oncology, it explored the relationships between gratitude and quality of life among cancer patients. It found a direct correlation. Those who reported higher levels of gratitude tended to experience improved quality of life and lower distress levels. While this doesn't directly measure survival, enhanced emotional health leads to increased motivation for treatment engagement and self-care, which can absolutely influence long-term outcomes. The study was Gratitude and Subjective Well-Being in Cancer Patients. It examined the relationship between gratitude and quality of life among cancer patients and its implications for mental health. Then we have resilience and coping. Resilience is another critical aspect of navigating cancer treatments, and gratitude may play a pivotal role. A 2016 study published in Cancer Nursing suggested that individuals who practice gratitude utilize more adaptive coping strategies. While this study did not focus on overall survival specifically, effective coping mechanisms are essential for psychological and physical health, particularly when facing significant challenges. The study was Forgiveness Education, a family intervention for promoting emotional well-being. The article highlighted relationships between gratitude practices, resilience, and coping strategies in the context of cancer. Gratitude can also promote a more positive attitude and acceptance of one's illness. Research published in Supportive Care in Cancer in 2020 identified a positive mindset nurtured by gratitude as being associated with better treatment adherence and psychological outcomes. Maintaining a hopeful and accepting outlook can play a critical role during treatment and recovery, indirectly affecting survival rates. The study was The Benefits of Gratitude in Life Adjustment. The research specifically explored beneficial effects that gratitude had on treatment adherence and psychological outcomes in cancer. Then we have the potential biological links. Some research is suggesting that positive emotions can influence biological processes that are critical in cancer management. For instance, a study in Psychosomatic Medicine in 2001 indicated that positive emotional states might reduce stress-related inflammation. Now, as a naturopath, this seems just seems like it should be common knowledge. However, I guess it's not, so we need to do research on it. Because when you have a positive emotional state, again, you're less likely to be in a fight or flight mode, right? Because you're not in a fear state, you're not in anxiety, you're not in worry when you have that positive mindset. And so it's almost like you're switching yourself into your parasympathetic mode when you're in a positive mindset. And what this study is suggesting that this switch to the positive mindset might reduce stress-related inflammation. It can have obviously a direct impact on cancer progression and overall health. So it's further supporting the case for cultivating gratitude. The study is Positive Emotions Trigger Upward Spirals Towards Emotional Well-Being, discussing how positive emotions can reduce stress-related inflammation and support our health. And then it's important to note that gratitude benefits not just patients, but also their caregivers. Studies show when patients express gratitude to their caregivers, it helps strengthen the support system and foster a more positive care environment. This supportive dynamic can lead to improved health outcomes for that patient. The study of discussion is when gratitude is not enough. Who gets help from whom? Examining the role of gratitude in strengthening support systems. So, while we need more substantial, rigorous studies to clarify the direct relationship between gratitude and overall survival in cancer patients, there is promising evidence that's suggesting that gratitude can positively impact various aspects of health and well-being. Integrating gratitude practices into oncology care can create a more supportive, empowering environment for patients, ultimately enhancing their quality of life and possibly influencing their health outcomes. As we continue this journey into the healing power of gratitude, consider ways you can encourage gratitude, not only for yourself, but for those around you as we all navigate life's challenges. We are not immune to walking through challenges. We get to choose how we walk through them, though. And gratitude can absolutely be a tool we use to help us along the way. Now, I hope that I have demonstrated the importance of gratitude. I want to explore some practical tools and practices that you can implement in your daily life. There are going to be quite a few here, and just as with the tools I've given you before, use the ones that speak to you because it's your practice and it's important that it's something that you will follow through with. The first tool is gratitude journaling. Spending a few minutes each day writing down at least 3 things you're grateful for. This shifts your focus from what you lack to what you have, fostering a more positive mindset. An add-on to this can be not just what you're grateful for, but also why you're grateful for it. So, for example, I am grateful for sunny days, right? Who doesn't love sunny days? Well, I'm sure there's someone out there that doesn't love sunny days, but that's neither here nor there. So, okay, why? I'm grateful for sunny days because I get to feel the warmth on my skin and it brings joy to my heart. So that's a little bit more expanded. So as you start in your gratitude journaling, list what you're grateful for. Then as you grow, start to list why you're grateful for it. The next tool are gratitude letters. Write a letter to someone that you're thankful for, expressing how they've impacted your life. If possible, read it to them or even send it their way. Because remember, as I mentioned above, gratitude not only benefits the person who is speaking the gratitude, but also the one who's receiving it. Then we have daily affirmations. Starting your day by stating aloud 3 things you appreciate about yourself and your life. This is not only going to build positivity, it's going to build self-love, it's going to build self-appreciation, and then you can even take it a step deeper and express why you appreciate those things about yourself. Next up, we have mindfulness and meditation. I feel like we've touched on this quite a few times in our discussion so far. You can incorporate gratitude into your mindfulness practice. Focus on what you are grateful for in the present moment. Guided meditation apps often have gratitude-themed sessions. Another tool is gratitude walks. This can be done at any time, in any place. During your walk, consciously acknowledge the things around you that you appreciate from nature to people, enhancing both your mood and connection to the environment. Then you want to share your gratitude. So another tool is regularly telling people in your life how much you appreciate them. This creates a cycle of gratitude that can both lift your spirits and theirs. And finally, we have gratitude rituals. Create a ritual such as a weekly family dinner where each person shares something they're grateful for. This is going to strengthen familial bonds and positivity. So now let's discuss some practical steps to help you seamlessly integrate these practices into your life. 1. Set a reminder. Use your phone or a planner to set a daily reminder for your gratitude practice. Consistency is absolutely key. 2. Designate a space. Create a specific spot at home for your journaling or reflection, making your practice feel special. 3. Get an accountability partner. Share your gratitude goals with a friend or a family member to hold each other accountable. 4. Start small. Don't overwhelm yourself. Start with 1 practice a week and gradually build. And 5, reflect on your changes. Keep track of how you're feeling and your mindset change as you incorporate these practices. As we conclude, I hope that you found this information valuable. I encourage you to embark on your gratitude journey in a way that speaks to your heart. Remember, this is about making small, sustainable changes that can lead to profound healing. If you are interested in exploring how gratitude and naturopathic vitalism can further enhance your healing journey, I invite you to register for a free 20-minute discovery consultation with me. Together, we can create a personalized plan that incorporates these approaches into your unique healing process. Visit the website Rising Phoenix Naturopathy to sign up. Thank you for joining me today on Healing Insights. I hope this conversation inspires you to cultivate gratitude into your life. Remember, it's not just about feeling grateful. It's about making it a practice that nurtures your overall well-being. If you've enjoyed this episode, please subscribe, leave a review, and share it with anyone who might benefit. Until next time, stay well and take care.